So trying to do systemic examination in patients with acute abdomen could be quite tricky. All right. So in the systemic examination, that's like, okay, you know that the gastrointestinal system is the one that is affected. Okay, but you are still going further to access other systems and what rule out other possible disease conditions associated to. So you actually do the systemic examination, and we just want to actually just let you guys know what you are looking for. All right, when you are doing systemic examination. All right, so systemic examination in patients with acute abdomen, what are the things you actually be looking out for? All right, so for systemic examination, if you are examining the chest, that's a cardiopulmonary examination. You know that what the chest is closest to the abdomen, so you have to always check the chest, because things from the chest can also cause what acute abdomen too. So for the chest, you are checking for things like what possible myocardial infarction. All right, you're checking for the possible myocardial infarction. Then you're checking for basal pneumonia. Then you're also checking for pleural effusion. That's what accumulation of fluid around the pleural cavity. All right, so you're checking for pleural effusion. You're checking for basal pneumonia. You're checking for what possible myocardial infarction. All right, then as you are checking for this, you're also keeping in mind the 9 quadrants of the abdomen. Is so important. Then for the abdomen itself, you have to do an inspection. Now when you are doing an inspection for the abdomen, it's like this. All right, so there are some couple of things that you'll be observing in doing the inspection. It could be that you are checking out if the patient has what ulcer. Okay, and if they have ulcer, you are looking out for if they have ulcer is kyphoid or flat. Okay, then you are also looking for distension of the abdomen. Okay, you are trying to see if there's abdominal distension, and this will be seen when there's accumulation of fluid in the abdomen. That's in ascites, right? Then also if there's intestinal obstruction, it also show up as what abdominal distension. Then you're also trying to look if there's visible peristalsis. Okay, if there's visible peristalsis, and you're trying to access all this if you suspect that there's intestinal obstruction or gastric outlet obstruction. That's the GOO. All right, then you're also trying to look at the abdomen to see if there's what erythema or discoloration. All right, so we've already made videos on all these signs. Okay, you are trying to see if around the umbilical region there's discoloration of the skin. All right, that's what is known as the periumbilical cooling sign. All right, they're also looking at what the inguinal fox region, that's around the inguinal region, if there's any discoloration. Then around the flanks, okay, that's the right and left flanks, you're trying to see if there's any discoloration too. That's a gray tunnel sign, and this will be seen in hemorrhagic pancreatitis. All right, then if you see the gray tunnel sign, or okay, any of the signs, any of the discoloration, if there's anything that is causing a hemoperitoneum, like if there's anything that is causing trauma on the abdomen and all that, it will show up. Right, if there's a bleeding underneath the abdomen, it will show up as what this discoloration. Okay, then you're also trying to look at if there's any visible masses. Then you're also trying to look at if there's any visible curve reflex at the hernia site. Okay, then for the abdomen, you should do somewhat palpations too. Now when you're doing some palpations, you have to be gentle. Okay, because it could be that there are some couple of pains underneath. Okay, that your palpation might trigger, or the patient forgot to tell you. Okay, so you have to be gentle. Then stay away from the site of pathology. Then check for hernia sites. Check for tenderness. Check for rebound tenderness. Rebound tenderness when you put your hand, you're about to remove the hand, and the patient is like feeling some sharp pain. All right, so check for rebound tenderness. Then check for muscle guarding, which is a voluntary spasm of the abdominal wall muscles during palpation. Then check for rigidity, which is reflex contraction of the abdominal muscles, which attains broad-like. Okay, so if it is this rigidity is there, it indicates peritonitis. Okay, then you guys already know what the different quadrants of the abdomen, right? And if you palpate different quadrants, if the sign is positive, it indicates these various disease conditions I see here. All right, then you check for local right iliac fossa tenderness. This will indicate acute appendicitis, acute salpingitis, and amoebiasis of the cecum. All right. Then low-grade poorly localized tenderness indicates what? Intestinal obstruction. Then tenderness out of proportion to examination indicates what? Mesenteric ischemia, acute pancreatitis. Then if there's tenderness on your flanks, okay, it indicates perinephric abscess or retrocecal appendicitis, right? Then if there's a renal angle tenderness that's around the kidney, it indicates what? Pyelonephritis. That's like inflammation of the tissues around the kidney. All right. Then you also check for Rovsing sign in acute appendicitis. This is what Rovsing sign. Rovsing sign is more of like, okay, the appendix is on the right lower quadrant, okay, but when I palpate the left lower quadrant, the patient will still feel pain on the right lower quadrant, right? So that's a positive Rovsing sign. You check out for obturator sign. You see this is the obturator sign, okay. You ask them to bring their leg to like 90 degrees and flex it outward, okay. So that's that's obturator sign. You check out for psoas sign. So as sign, you ask them to lie left lateral, okay. Then bring their leg back, okay. So if they feel a sharp pain on the lower quadrant, it shows that what there's an inflammation there. Then this can help you spot out for diseases like what? Retrocecal appendicitis, Crohn's disease, perinephric abscess, okay. The Murphy sign is what is used in acute cholecystitis. If there's inflammation of the gallbladder, the Murphy sign is always what? Positive. Then the Kerr sign will be seen in what? Splenic rupture or splenic abscess, right? Where I think the pain is referred to the right upper shoulder or something like that, all right? Then pulsatile what? Abdominal mass with hypotension. Cutaneous hyperesthesia, like you want to check if the skin is too sensitive, all right? The skin is too sensitive. Then this will indicate if the skin is too sensitive, it indicates what? Involvement of the parietal what? Peritoneum. Now we have the visceral peritoneum, which is covering the organs and all that. Then we have the parietal peritoneum, which is closest to the skin, okay. So if the skin is involved, if the skin is hypersensitive, that means what? The part of peritoneum that is closest to the skin has been involved in the disease condition, all right. Then rectal examination. These are the various what? Positions for what? Digital rectal examination, all right. So in digital rectal examination, you're trying to look out for what? Tenderness. You're trying to look out for induration. You're trying to look out for a mass, that's a blue mass sheath. You're trying to look out for what? Frank blood in stool. Then for the vaginal what? Examination, that's VE. You're trying to look out for if there's bleeding in the vagina. You're trying to look out for if there's like discharge in the vagina, like let me say like a bloody discharge, or how will I put it? Yeah, it could be bloody discharge, it could be whitish discharge, right? Then you are also trying to look out for cervical motion tenderness. You are trying to look out for adnexal masses or tenderness. You're trying to look out for what? Uterine size or contour. All right. So guys, that's it about what? Systemic examination in patients with what? Acute abdomen or patients with abdominal pain. These are things to note, right? Things you should note, all right? So 9 minutes lecture actually covers a lot. We'll see you guys pretty soon.